Hi, and welcome back to Type 1 Diabetes Explained. So if you've been diagnosed with Type 1 diabetes, there's one pretty big issue. How do I tell people I have diabetes? Now if you're a pretty open person, this may not seem like any big task, but if you like your privacy, this can seem like the worst thing to need to do. So let's go through this process together. First, we'll categorize people on the urgency that they need to know about your diagnosis. There are 4 categories: the need to know, the should know, the nice to know, and the don't need to know. Here's who falls into the need to know category: teachers and school administrators, close family members, and sometimes employers. Schools need to know so that they can be sure that you are safe while in class, and family members need to know so that they can take care of you. You are not required by law to tell your employer, but it is highly recommended so that you can remain safe while at work. Then, there are some people that should know, which includes their relatives and close friends. You don't need to tell these people right away, but they would most likely want to know. These people care about you and want to know how you are doing, so it would probably be wise to tell them. There are the people who it is nice to tell. This is basically everyone else you know on a personal basis, including all other friends. They don't need to know, but it's nice to tell them. And finally, we have the people that don't need to know. This includes everyone else not included in one of the prior groups. Those who don't need to know include people that you just met or people you only know for a short period of time. Now that we have everyone divided up into whether they need to know, should know, would be nice to know, and don't need to know, we can look at timelines for telling people. Those who need to know need to be told relatively fast, as in 1 or 2 days. Telling them as fast as possible is imperative so that they can make preparations and accommodations and make sure that you are cared for properly. Make sure that these people are told in a timely manner. The people who should know can be told anywhere from a few days to a few months after diagnosis, or even longer if you're more comfortable after more time. And the people who would be nice to tell can be told anywhere from a few days to about a year. But after a year has passed, people begin to feel left out, especially if they've known you for a while. But then again, it's completely up to you. Now that we know who needs to be told and when, we can look at the different methods of telling people. For the schools and employers, emails or letters are by far the best option, as they allow you to write whatever you want and are also more documentable than other methods, such as phone calls or telling them in person. However, it is a good idea to follow up with them in person to make sure that they receive the email. Your email can be as professional or personal as you want. If you're looking for ideas on what the email should say, take a look at the Type 1 Diabetes Explained website for model emails that you are free to use or adapt for your unique situation. For the people who should know, options are a little bit more flexible, as these relationships are a little more personal. Phone calls, emails, texts, letters, and telling them in person are all good options. And for those who would be nice to tell, you can do pretty much any method you want, including all of the previous, and one called the Let It Happen method. The Let It Happen method is basically you treat your diabetes as normal, make no effort to hide it, and if they notice, then you just tell them. It's simple and doesn't involve a lot of stress about thinking about what to say. If you want to take this a little more proactively, you can purposely show people that you are treating as a method to tell them, such as checking your blood sugar, giving insulin, or getting out your CGM or insulin pump. This is one of the easiest methods for some people, as it will just happen, most likely be brief, and is very casual. Remember, this is your diagnosis. You are the boss of who gets to know, so feel free to do anything differently than what we have said. These are just suggestions about what has worked best for us. If you're looking for examples of emails, letters, and what to say when telling people you have type 1 diabetes, make sure to check out our website, as we have many model emails and other resources to help you get through this process. And if you are afraid of telling people for fear that they will think of you differently, they probably won't, because they often simply forget. Real story, I told someone I had diabetes. 5 months later, they saw me pull my insulin pump. They were very surprised that I had it and forgot that I had ever told them. If someone really cares, they don't let the fact that you have diabetes change what they think of you. Remember, you get to define your diabetes. Diabetes does not define you.